discussed the bacilli. Let's go on and now talk about the other spore-forming bacteria, and that is Clostridium. Now, under Clostridium, you know we are going to have Clostridium perfringens, tetani, botulinum, lots of those. But before starting with them, what did we talk about? What kind of an organism is it? Spore-forming organism. And if I ask you about Clostridium, I hope you know B was not for B, so Bacillus was not the bulging spore. Clostridium is the bulging spore. I've got a lot of bulging spores over here, but now I'm going to ask you the location. So please remember, the most common location of a spore is the subterminal, right? Subterminal location. So for example, Clostridium perfringens, what kind of a spore? Subterminal formation of spore. Okay, however, if I say that when does spore become terminal, when is it present right at the end of the bacteria? So you will say TE for terminal, TE for Clostridium tetani, so TE over there, and TE for Clostridium tertium, so TE over there. So repeating, we have TE for terminal, TE for tetani, TE for tertium, and you can see that over here. You can see this is terminal and oval, this is terminal and round. Yes, terminal and oval, terminal and round, because this is terminal and round, so it looks like a drumstick. Tetani is going to look like a drumstick, whereas tertium is going to be oval spore, so that is going to look like a tennis racket. Many students get confused in the exam which is drumstick and which is tennis racket. So again, tertium is TER, tertium is TER, which is TE for tennis and racket. TER for tennis racket. So tertium is tennis racket and tetani is drumstick, but both have TE, so both are terminal. What are we left with? We are left with which of the spores are going to be right in the center. So you can see the spore is right in the center. That is Clostridium bifermentans. So bifermentans is anyway telling you that, okay, it's divided it into two parts. It has divided the bacteria into two parts. So Clostridium bifermentans, in fact, one Bacillus cereus can also result in a CE for central spore, right? So now if I ask you guys over here that which is the most common location of a spore, the most common location is going to be subterminal. But if I say where do you see TE terminal, you will say TE tetani, TE tertium. Which out of them is tennis racket? Tertium is going to be tennis racket. Like I said, tertium is tennis racket and tetani is going to be drumstick. What is the location of the spore in bifermentans? By dividing it into two, so the location is going to be central. All of this is done. Now let's move on to the different types of Clostridium. Now tell me common features. Is this a gram-positive bacilli? Yes. Can this have a B? Correct. These are going to have bulging spores, and I also told you it's an obligate anaerobe. All this I taught you in the previous Bacillus wala chapter only. Now I'll tell you something extra. Please note that mostly they are unencapsulated. Mostly these do not have a capsule. However, PCB. What? Physics, chemistry, bio. So, physics, chemistry, bio. Why did you take, let me ask you one. Why did you take physics, chemistry, bio? Which is the exam that you wanted to crack? You wanted to crack the PMT exam. These are your two mnemonics. So, I took physics, chemistry, bio for PMT exam. So, PCB. PCB का क्या मतलब हुआ? That when you are dealing with Clostridium P for perfringens, and you're dealing with Clostridium butyricum, these are the ones which are gonna have a capsule. They are gonna contain a capsule. So capsule is present. Remember, all the Clostridia are unencapsulated, but perfringens and butyricum is gonna be capsulated. Similarly, all of them are going to be motile. All the Clostridia are motile. But देखो PCB क्यों लिया था? Which is the exam that you wanted to kill or you wanted to crack? PMT kill करा था. So now I'm asking you kill. मतलब which of them are non-motile? Again, the P over here stands for Clostridium perfringens and T stands for Clostridium tetani type 6. So simple. Let's do a very quick recap. You have two things. One is PCB. So which are the capsulated ones? Perfringens and butyricum. Which exam did you want to kill? I wanted to kill PMT. So non-motile कौन है? Perfringens and tetani 6. This is also done. Now we can go on to this exception because perfringens is coming as an exception everywhere. Now tell me, what is it with capsule? Yes, perfringens has a capsule. Is it motile? No, it's not motile. So now we come to Clostridium perfringens, which was earlier known as Clostridium welchi. Let's begin with that. So like I told you, it is non-motile and it has a capsule and it is a gram-positive bacilli. And I've told you the most common location is subterminal spores. So now you realize if you've done the PCB, PMT and spores wala topic, now you don't have to do for every organism separately. Now you know which one is coming under which category. So now let's know basic. If I give you, this is that gas gangrene wala story that I'm starting with. Perfringens causes gas gangrene. So here we have the virulence factors. There are lots of virulence factors. Some of them are major, some of them are minor, some of them are just enzymes that you have. So repeating, the major ones yaad kar lo. Alpha, beta, epsilon, iota. What did I say? Alpha, beta, epsilon, iota. These are going to be the major ones. And after that, all the alphabets that you know, gamma, delta, kappa, lambda, theta, eta, mu, nu, whatever ones you know. So kappa, lambda, delta, theta, eta, mu, nu, all of these come under minor. And what are the enzymes? Histaminase, neuraminidase. These are all coming under the minor wala enzymes that are there. Okay. Out of all of these, 4 major to ho gaya, but the one that I want you to learn is alpha. Alpha is going to have a lot of properties. Alpha is also known as lecithinase and phospholipase C. So, ye lecithinase kahan use hoga? That you will come to know in 10 minutes. Okay? But just remember that the alpha, major alpha one is going to have a lecithinase activity. These are the virulence factors. What is the disease that it's causing? Of course, this is going to occur because of a wound infection. So most of the times there is some road traffic accident, some crushing injury, some kind of wound infection that has occurred. Because of it, starting mein to it is just any like simple wound contamination can occur. But in advanced cases, it can result in anaerobic cellulitis, and it can result in the most deadly gas gangrene. What is gas gangrene? It is said to be, why am I using the word anaerobic everywhere? Because Clostridium by definition is anaerobic. And myositis, because gas gangrene is a type of and myonecrosis. It is a type of a myonecrosis. So how is the muscle dying? How is that crushing injury, whatever injury we had, how is it making the muscle die? And that is what I'm going to tell you. So firstly, if you want this organism to work, if you want Clostridium perfringens to work, number one, every Clostridium requires anaerobic. You need anaerobic environment. Secondly, the wound has to be contaminated. Very rarely will it occur spontaneously. Most of the times there is some road traffic accident, some crushing injury, some trauma, aisa kuch history hoga. So that number one, there is some contamination that happens. Okay, now let's start from here. If a contamination has happened, chalo, there was a road traffic accident and the wound has occurred and the wound has been contaminated with a Clostridium perfringens. I told you Clostridium perfringens has a very important toxin called alpha toxin. Alpha toxin has lecithinase activity. So what is that lecithin going to do? Lecithin is going to damage the cell membrane. Lecithin, wherever lecithin is present, it will damage it. Means the blood vessels are damaged. The capillary permeability will increase. All the fluid will come out of the capillaries. If these were the capillaries, I'm saying that all the fluid is basically going to come out. All the fluid will come out. This means now the muscles are tense, that oh, this muscle was sitting over here, but now there is so much of fluid that is coming, so it's creating a lot of pressure on that muscle. There's a lot of tension in this muscle that is created. Matlab, muscle goes into further anoxia, further oxygen will go down, further anaerobiosis hoga. So this entire cycle is then going to become vicious. More the oxygen goes down, more happy the perfringens is that, I wanted anaerobic environment and so I have got it. Meanwhile, this alpha toxin is also going to do something very important, and that is it is hemolytic. It starts breaking the red blood cells, and you know hemolysis hoga, so all the hemoglobin will start coming out into the urine. These patients also have hemoglobinuria. So please remember, number one, there is going to be a lot of tension on the muscle. That is also done by alpha toxin, and similarly alpha toxin can also cause hemolysis over here. तो कैसा दिखेगा? How is the gas gangrene going to look like? So firstly, when we are talking about any kind of gangrene, we know for a fact that there is a lot of foul smelling, blackish, very dirty looking tissue that is there, because this is nothing but a case of myonecrosis. So what is the patient going to be? The patient is going to be in a lot of pain. There will be some discharge, as you can see, that is coming out. But gas gangrene means that there are gas bubbles that have formed. How will I get to know? That will be that cut wala sound. That cut sound is nothing but crepitus. Crepitus is going to be there, and that is something which will distinguish this gangrene from all the other gangrenes. There's going to be crepitus, and in, of course, some patients there can be shock as well. So now my question to you is, you understood gas gangrene is caused by Clostridium perfringens, but is Clostridium perfringens the only organism that causes gas gangrene? No. Remember, gas gangrene is caused by PSN, not PSM. It is PSN. Okay, gas gangrene is going to be caused by PSN. P for perfringens, we know. Septicum and novi. Perfringens, septicum, novi. Why have I said that you have to learn it as PSN? Because you will see that the incubation periods are increasing. Perfringens ka incubation period is less than 2 days. then it is going to be 2 to 3 days, and 3 ka double, the next one is going to be 6 days. Simple. So less than 2 days, then we have 2 to 3 days, and then roughly up till you can say 6 to 5 to 6 days, that is going to be perfringens, septicum and novi. All of these are three are capable of causing gas gangrene. ठीक है, so now you will obviously ask me the next question कि gas gangrene हो गया मैम, this is how my patient is looking like. Can you tell me the treatment part of it? Of course. What are you going to do? First and foremost, you need to understand there's a lot of dead, look at this, there's a lot of dead muscle, dead stuff here, debridement. Surgically, you will have to remove it. So the first thing will always be surgical debridement. After that, you will have to give patient antibiotics. So there is IV penicillin plus clindamycin, which is started for almost 2 weeks, 10 to 14 days, right? So there is going to be surgical removal, then you're going to give IV penicillin, then you also have to think of something. That this gas gangrene had happened because of anaerobic environment. So don't maintain anaerobiasis, give oxygen. You also have to consider hyperbaric oxygen. So surgery with hyperbaric oxygen, with IV antibiotics, penicillin and clindamycin, that is your treatment. And in some cases, you can also give the anti-gangrene serum. That can also be given. That may or may not be given, but passive immunization can be given in many of the cases. So you will say that, ma'am, in this you've not told us any diagnosis. You give the clinical disease, you give the treatment. Diagnosis kahan gaya? Because the clinical is not over. If you feel that Clostridium perfringens only causes gas gangrene, you are mistaken. Clostridium perfringens causes a lot of other things also. Number 2, it can cause food poisoning because it has got some heat resistant spores. So it is basically because of some warmed up or cold meat, basically heat resistant spores hote hain, to food poisoning ho sakta hai. And because I'm talking about intestine, this can also cause gangrenous appendicitis. This can also cause necrotizing enteritis. Please note, and I've written some types which causes, which is not very important for you to know. If you wish to know, you can learn that gangrenous appendicitis is usually caused by the type A form, A for A, and necrotizing enteritis. Enteritis means colon. So colon wala is caused by type C. So remember, appendix wala is caused by type A and colon wala is going to be caused by type C. But as I said, not very important. Remember, these are some of the intestinal manifestations, and this is a PYQ. Necrotizing enteritis is caused by which of the following Clostridium species? So perfringens is not just gas gangrene but a lot of food poisoning. In fact, I'm going to tell you one very interesting food poisoning. Uska naam hai pig bell. Pig bell is something which is not very common in India but very common in European countries. And what is pig bell? So pig only tells me that, okay, yeah, there's going to be a pig involved. So there's going to be pork and potato. Pork and potato. So pork consumed along with sweet potato can cause this. Why? Because pork means there is some kind of infection that is going to come. Infection means Clostridium perfringens can come. Perfringens means it is going to have the beta toxin. Over here, I am talking about Clostridium perfringens and I am talking about the beta toxin. And you know, so theek hai, you will say, fine ma'am, beta toxin aa gaya. But then, you know, all of us have an enzyme called trypsin, hai na? Trypsin can break beta toxin. What happens is, trypsin has an ability that it can break beta toxin. So we shouldn't have had a problem. Problem happened because we consumed it along with sweet potato. You know what sweet potato has? Sweet potato has trypsin inhibitors. Now there is no trypsin available, no one to break beta toxin. Beta toxin is going to work uninhibited. So this prevents the breakdown of beta toxin in the intestine. Please note, see, if only pork would have been consumed, it wouldn't have caused much of a problem. Pork along with sweet potato ka combination which you call as pig bell. So pig, of course, pork and potato. That is pig bell, right? And you, although the exact pathogenesis is not very important, but you have that curiosity, so you can learn that, okay, sweet potato has trypsin inhibitors. Trypsin was the one which was going to break this and, you know, this toxin for me. Now, sweet potato is not letting it do that. So how do I treat it? I'm going to give IV penicillin with metronidazole. So please remember, pig bell, you're going to give pig, matlab pork and potato, and you're going to give penicillin. Penicillin and metronidazole is what is said to be the treatment, right? Now, finally, all your clinical features are done. Now I can tell you the lab diagnosis in general. So think of what lab diagnosis will you have, what sample will you take up. For example, gas gangrene ka case hai. So you will take all dead tissues, the muscle which has died, the necrotic element. Of course, that is the specimen that you'll get. Microscopically, we all know Clostridium perfringens is going to show you what kind of spores. Clostridium perfringens is going to show you the Yes, guys, it's going to show you subterminal spores. Fine, that will also be noted. What beyond that? You will also be seeing that, chalo, now tell me, gas gangrene is only caused by Clostridium perfringens. Nahi na, it can also be caused by Clostridium septicum. Remember PSN, Clostridium septicum में क्या दिखता है? You don't have to know a picture, but there's a body called citron body. देखो, citron has a lot of C's in it, so it is caused by Clostridium septicum. ठीक है, सारे C's वाला thing are gonna come together. Which Clostridium? Clostridium septicum has citron bodies that can be seen. Finally, what is the media? Go back to your culture media chapter. I have taught you any anaerobic organism will always be grown on Robertson's cooked meat broth. Any anaerobic organism is grown on, be it Clostridium perfringens, tetani, so any anaerobic organism is grown on Robertson's cooked meat broth. And I always used to tell you, you used to ask me that, ma'am, perfringens में क्या reaction होता है, proteolytic or saccharolytic? And I told you my favorite mnemonic of path and micro, P will never be for P. Perfringens is not going to be proteolytic, perfringens is going to be saccharolytic, right? So perfringens is going to be saccharolytic. P is not for P. So remember, perfringens is saccharolytic, and later on when I'll ask you tetani, that will be proteolytic. So perfringens के साथ proteolytic मत रखना, perfringens के साथ saccharolytic reaction on a Robertson's cooked meat broth. So specimen done, microscopy done, media done. But abhi to there's a long way of things that are gonna come. Remember, this perfringens is the one which causes gas gangrene. That has a mnemonic called senior NTR. Very famous mnemonic. Senior NTR, so means what? So first I'll tell you the full form. Senior stands for stormy clot formation on litmus milk. Senior stands for stormy clot formation on litmus milk. Let me show you the picture here. Have a look at this. You don't have to know the pathogenesis, but this is a kind of a, you can see this is a litmus milk test, and can you see this very, very famous storminess that has developed over here? Storminess with a clot. So stormy clot formation that has occurred on litmus milk test. That is senior. Now what is N? N stands for the very famous Nagler's reaction. Now this is important because this gets you image-based, theoretical, understanding, subtype ka question. So what is Nagler's reaction? Have a look at this slide over here. Firstly, what do you have? It's a culture plate, and this Nagler plate is famous for what? This Nagler plate has basically egg yolk based agar in it. You know what is egg yolk? Egg yolk is very, very rich in lecithin. Egg yolk has a lot of lecithin. So what I've done, I've divided this culture media into two parts, because over here I'm gonna put the sample of the patient. As soon as I put the sample of the patient, sample of Clostridium perfringens, do we all know that Clostridium perfringens has alpha toxin, and I told you alpha toxin has lecithinase property, and that lecithinase is basically now, will it break? Because this has lecithinase property, that is the alpha toxin, and egg yolk has lecithin, so breakage hoga. This will go and start breaking the lecithin. It will go and break the lecithin. That is why what you will get will be an opaque area. So opaque area matlab the toxin is there, alpha toxin is there. I still wanted to confirm it. You know what I did? On the other side, I put antitoxin. कि अगर toxin है and I put antitoxin, it will cancel out. Toxin, antitoxin will cancel out, and that can you see? There is no opacification that is noted. There is no opacification that is noted. So repeating once again, if you get an opaque area, this means the lecithin or the lecithinase, that is alpha toxin, has gone and broken the egg yolk ka lecithin. Reaction has occurred. And if I added something to neutralize it, the reaction has vanished. That is known as the Nagler's reaction. So the question asked is Nagler's reaction is going to use what? So I'll separate these out. S was for stormy clot formation on litmus milk. N is Nagler's reaction. Nagler's reaction is then on egg yolk medium, and it measures what? It is going to measure the alpha toxin or the lecithinase toxin. Coming to the next, T is going to be for target hemolysis. There is something known as target. Target matlab we all know na how dartboard ka target hota hai. So same way, the same picture has been shown over here. It shows you target hemolysis, means double zones are gonna be there. Some people call it target hemolysis, some people call it double zone hemolysis. Matlab there is, I'll repeat it for you. There is an inner part of hemolysis, there is an outer part of hemolysis. So remember, the inner part of hemolysis, which is complete hemolysis, is caused by the theta toxin. Inner one is caused by the theta toxin, whereas the outer outer one, which is incomplete one, which is caused by the alpha toxin. So please remember the inner one. Let's erase this. The inner one is going to be caused by the theta toxin and the outer one is going to be caused by the alpha toxin. So just remember कि center में वो theta fit हो जाता है, center में ऐसे theta fit हो जाता है. So center one is going to be by theta toxin and the outer one is going to be by alpha toxin. That is the double zone or the target hemolysis. So senior NTR mein what am I left with? There is something known as reverse camp test positive. Okay, so first and foremost, you will, before I tell you reverse, you will have to tell me camp test. Can you tell me that what was the mnemonic which I told you? I told you someone is having a gala time in the camp. Gala time in the camp matlab camp test is by Streptococcus agalacti. Agalacti was for gala time in the camp. And one more organism has a gala time in the camp. Remember that organism who's drunk tulli wala organism, Listeria. Listeria was also having a gala time in the camp, hai na? So that is going to be the camp test. Fine. So now I'm not talking about camp test. I'm talking about reverse camp test. So pehle to you will have to tell me camp mein kya hua tha. Camp mein you'll say, ma'am, the long axis wala line that you had drawn was Staph aureus and the perpendicular axis was gala, was agalacti. Right? You will say that, ma'am, over here also, this agalacti is still like this. Agalacti is still like this. The labeling of this has changed. The labeling of Clostridium perfringens has changed because right now you told me that perfringens can also have hemolytic properties. Agalacti also has hemolytic properties. So dono ka hemolytic property gets enhanced. There is something known as an arrowhead formation. There is an arrowhead formation that tends to occur at the junction. So what I realized is whether it is camp test or it is reverse camp test, ये जो long axis वाला, ये जो leta वाला line है, ये जो horizontal line है, that is going to be gala because gala time means lying down ना. So gala is always going to be lying down. Gala time, agalacti always lying down. Who is standing up is going to change. So in the camp test, it is the aureus that is standing, and reverse camp test is for Clostridium perfringens. So that is the one that is standing over here. I hope that is okay because that wraps up senior NTR. There is stormy clot formation, Naegler's reaction, target hemolysis and reverse camp test. Perfectly done. And that means we are done with our story of Clostridium.